Welcome to Uncovered with Francesca. I'm Francesca Giacomini, a well-being expert. Today, we are exploring the biggest transition in a woman's life, perimenopause and menopause. Today's guest is Dr. Simone Rofena, a gynecologist and leading expert at the Lanserhof at the Arts Club. Today, Dr. Simone is going to help us, right?
Yeah, it is my pleasure, Francesca, to be here with you. And yes, we would like to give some information to our patients today.
What is perimenopause and menopause, and what is the difference?
Very good question. So the perimenopause is the transition to menopause, which can last even for several years. Whereas menopause is that condition whereby a woman doesn't have periods for 12 consecutive months. So before this time, we can't talk about menopause. So if a woman has irregular periods but is not over 12 months, that is perimenopause.
And it's having irregular periods a sign of perimenopause or not?
Absolutely. Is the first sign, I would say, of perimenopause. Although it can happen for other reasons. But when a woman is in that age, in late 30s, early 40s, and starts having irregular periods, which can be more frequent or more rare, sometimes lighter, sometimes heavier, that could be the first sign of perimenopause.
What are the causes of menopause?
Well, actually, is the reduced production of estrogens because the ovaries are aging and do not produce the hormones, particularly estrogens, as regularly as before.
Is it true that during perimenopause and menopause a woman can gain weight, have a loss of libido, and feel more tired and brain fog, in fact?
This is very true because all these things are regulated by the hormones and particularly estrogens. So when the production of estrogens starts to reduce, then all these symptoms you have mentioned can start.
What do we do to delay the process?
Well, the best.
If we can, in fact.
Yeah, no, we can, or at least, well, we might not be able to delay it all the times, but we can deal with the symptoms. So as soon as the symptoms start, we can stop or reduce them. And the best way is to provide the woman with estrogens, actually.
Can perimenopause or menopause start early than a woman expected?
Yes, it can, and there are some reasons behind that. In most of the cases, the onset of the perimenopause and menopause is genetically determined. But on top of that, even lifestyle and environment can be important. So, for example, things like smoking can cause the start of the perimenopause and menopause being earlier than it would happen if a woman doesn't smoke or has never smoked in her life.
And what about eating sugar? Can that increase menopause and perimenopause, or having a bad eating habit?
Well, the evidence is not there for this as it is for smoking. Okay, but this can cause other problems like diabetes, a problem with insulin resistance. So as weight gain, so as more metabolic effects rather than causing menopause.
So let's say that eating eating healthy can help us to reduce the symptom of menopause or perimenopause.
Exactly. Can help us managing the symptoms and also things like body composition, because after menopause, the fat tissue tends to be distributed differently, is more in the abdominal part, like it happens with men.
Mhm.
Okay, so if we have good health habits, and we reduce the sugar intake, we increase our physical activity, so the insulin metabolism and the insulin resistance improves, then we can have a lot of benefits in terms of health and well-being.
Is it true that during perimenopause or menopause can we increase vaginal dryness and lowered sex drive?
Yeah, this is very true, because these are all symptoms related to reduced presence of estrogens, which unfortunately is the case in perimenopause and more importantly in menopause. So yes, this is true.
And what about brain fog?
Yeah,
And lose of memory, because
Yeah.
sometimes you don't remember where you put your keys.
Yeah, that's very true. Unfortunately, this is a symptom that is very frequent, and it can be improved significantly by taking HRT.
And does menopause promote faster aging for women?
Well, I wouldn't say that it promotes a faster aging, but certainly makes aging harder, okay? Because lots of the symptoms related to aging depending on hormones. So, for example, think about how important estrogens are for collagen and skin elasticity.
That's why a lot of women complain of skin laxativity when they are in menopause, and even as early as perimenopause.
Exactly. And that depends very much on estrogens. Okay, so skin elasticity, but also hair, that
The loss of hair.
the loss of hair, which is estrogens and hormonal dependent to some extent.
So what do we do?
Well, the only effective thing is to replace the hormones through HRT.
That's the only way?
That's the main thing, I would say. Yes.
And is menopause genetic or not? So let's say like this. I get my period later in life, say I'm 17, 18, that can happen because my mom was like that. And then menopause happen later in life because the first period came later in life, or it's not related?
No, I wouldn't say that. I think we have enough studies and enough evidence now to say that is not the case. So the age at which the period started do not determine the onset of menopause. But it is very true that menopause is genetically determined. So if in the family there is a history of late of early menopause, that is a risk factor, or it can be a good factor. It depends on how what is the case. So yeah, the genetic factor is the most important.
Dr. Simone, why some women suffer very badly of menopause and some other have no symptoms?
Yeah, this is very true, Francesca, and it has more to do with the genetic factors and the genetic predisposal to experience more or less symptoms. That is mainly genetically determined, I would say, but it's very true.
And is there anything like a men menopause?
Well, there is a male version of that, which is
The menopause.
called, yes, yeah, that's a good one. It's called andropause, and is related to a reduced production of testosterone in men, which is the equivalent of a reduced production of estrogen in women. Although in men is less abrupt than in women. So that is why normally the symptoms are less severe in men than in women.
You know, I have a friend of mine who is taking GLP-1, like Ozempic, Mounjaro, and she said that once she start taking it, then menopause and perimenopause appeared. Can that be related?
They can, and the explanation has to do with the changes in the body composition that this medication, GLP-1, can induce. Because by reducing significantly the amount of fat that women have in their body, they can reduce significantly the production of estrogens, because estrogens are mostly converted and produced in the fat tissue. So if you reduce drastically through these medications the amount of fat tissue, then you should expect a reduced levels of circulating estrogens, which are responsible for the perimenopausal and menopausal symptoms.
But wait, because gain weight is linked to menopause. So women who are in menopause, then they start to put on weight. Yes and
Well,
no?
I mean, as we discussed in another episode, this is not necessarily true, because you are not expecting to gain fat
Mm-hmm.
only just because of the menopause. You increase the fat amount if you eat more, which sometimes is related to other reasons. Anxiety,
Yes.
for example, which is related, is one of the
Sleep
symptoms.
disorder?
Sleep disorder, that are linked sometimes to increased appetite. Some people eat to compensate anxiety and stress, sleep deprivation. Okay, but we can't say that the menopause in itself causes weight gain.
But it does cause osteoporosis and loss of bone density in the body.
Yeah, that's another matter, and yeah, that is true, because estrogens are responsible for bone density. So when estrogen starts reducing, then the bone structure starts being reduced as well.
What can we do naturally to prevent this from happening?
Well, naturally, and this is a key point I want to strongly recommend and underline to all the women who are listening, is the best way to prevent that is to start working on body composition through regular physical activity, weight exercise, strengthening core resistance, high resistance exercise. These are all good ways to strengthen the muscles and the bones, which are affected by estrogens. Lack of estrogens can reduce bone density and also the muscular structure. So I would suggest to do more and regular exercise.
Can protein help also with more muscle and with the menopause or not?
Absolutely. Because proteins are the essential structure of muscles. So,
And amino acid
and
as well.
amino acids. So the diet must be rich in proteins rather than carbs. Okay?
Or sugar.
Or sugars.
Sugar is evil.
So there needs to be this shift towards proteins, taking calcium through supplements, because calcium is very important for bones. Okay, and vitamin D is also very important for bone density. So I would say a combination of regular physical activity and lifestyle and nutrition. They are essential.
Dr. Simone, is it true that blood tests alone are not helping us to discover if we have menopause or perimenopause?
Yeah, I would say this can be true because the blood test just does give us just a snapshot, and it can vary a lot between one day and another, and sometimes even on the same day between morning and evening. Okay, so taking just one blood test and making conclusions can be inaccurate. It's much better to rely on the symptoms like cycle irregularities, sleep problem, for example, hot flashes, brain fog sometimes. These are more indicative of the perimenopausal changes rather than just a blood test.
So it's hot flashes a myth or is a real thing?
No,
Do women really experience hot flashes?
they do. They do.
Oh, wow.
It's not a myth at all. On the opposite, one is one of the most indicative symptoms, and is one of the things that impact the most on quality of life. Because if you have a bad sleep, that can affect many other things.
And hot flashes can happen anywhere, anytime?
Anytime, yeah, yeah. They tend to be noted, and they tend to happen more in the evening, but it can help even during the day. And this can be very embarrassing for a woman because if that happens when you are at work, for example, that can be, yeah, very, very uncomfortable and socially quite embarrassing.
What can we do naturally to prevent this?
Well, naturally, unfortunately, there is only a limited amount of things that you can do because this is due to hormonal changes. The real effective treatment is to supply the hormones that are missing. Naturally, you can train yourself to control, for example, the embarrassment. But the symptoms are due to lack of hormones.
If there is a woman who is watching now and she's really suffering of menopause, what is an advice that you could give her to help?
Well, the best advice would be you don't have to take this alone. The support is there. So you don't have to push through that or to be resigned to have the symptoms and the poor quality of life. The help is there to, so the best advice I would like to give to the women who are listening is to speak to a specialist and seek help because the help is there and is very effective.
How can we prepare for perimenopause and then menopause? Is there something we can do to prepare ourselves?
Yeah, the best thing is to start working on our health and well-being through what we have discussed before. So making it an habit of doing regular physical activity to strengthening the bones, strengthening the muscles, having a good diet, a good nutrition to also boost energy levels. These are the essential things a woman should do even before starting having the symptoms. So build a strong foundation which will help the transition of perimenopause and menopause.
So women, when they get menopause, they get like, oh my God, my life is ending. And also men perceive that, or they cannot have more babies, so they are becoming older. So why the society pushes us towards that and make us feel ashamed to actually have something that is very natural.
Absolutely. And that's why women do need to have more knowledge that this is a natural condition, as you say, and that can be treated. So they don't have to suffer that and all the implications on a psychological level and a social level. This is a natural condition. This is not a disease. It's a natural condition that sooner or later is going to happen. But luckily, we have an effective treatment for that.
Like hormone replacement therapy and also natural way to improve menopause, which is lifestyle habits.
Absolutely, yes. So the message I would like to send is that women do not have to suffer this. They have to know that this is a natural condition and they can do a lot to feel better.
So remember that if you're suffering of menopause and perimenopause, you are not alone. We have experts that can help you. We have support. Thank you, Dr. Rofena, because it was such an insightful conversation. And if you have anyone who is suffering from it, please share this episode. And if you like the episode, please subscribe, make a review, and help us to grow, because then we can bring to you more ways to live your life better. Thank you for watching us today. Thank you again, Dr. Simone. Until the next episode. Bye.
Thank you.